Thank you very much for joining us today on the program, Healthy Living. My name is Adesuwa Usa Uwagie. Come Thursday, 10th of October 2019, the world will be celebrating World Sight Day. And so we're beginning today on that very good note to let you know that there are things you need to do to keep your eyes safe. There are things you ought not to do if you want your eyes to be safe. Why is it difficult for people to want to wear glasses? The moment you tell somebody that, oh, you may need glasses, and the next thing is, God forbid, you know that sign. People don't like it. And then they say wearing glasses as a stigma. I was one of those who used to think that wearing glasses was a big deal, you know. But then you need to see clearly. And if you're finding it difficult, go to the hospital, get a prescription and wear glasses. There are some who just enjoy wearing glasses. You know, they love it. They see it as a status thing, you know. When you wear glasses, you are like there. But it's not so. When you wear glasses that are not prescribed for you, you're sure going to face some consequences. In about 10 persons, 3, 4 must wear glasses, whether they want it or not. So we have somebody in the house who's going to be talking to us about care of the eyes, what is refractive errors, glaucoma, cataract, you know, everything that has to do with the eyes. So if you don't have airtime on your phone, please go get some so that you can speak with our doctor. She is an optometrist and she's going to be talking to us seriously. And so if you're ready, then I am ready. We have a phone number with which you can reach the doctor. The number is 052-290573. I'm just going to do a little bit of talking. I expect you to do all the talking, all the asking. Ask everything that you need to ask, all right? So let me introduce to you our doctor. She's Dr. Iwadi Ozo. I hope I got that right. She's an optometrist and Born Opticals. That's where you're from. Yes. It's nice to have you join us, doctor.
Thank you. Same
I always admire your very beautiful low cut. You know, I wish I can go that low.
You can.
All right, doctor. Come Thursday, the world is going to be celebrating World Sight Day, a day set aside to create awareness, you know, for people to know stuff and things about the eyes. So can you tell us a little bit about that day?
Okay. Every year, the world celebrates World Sight Day on the second Thursday of in the month of October to create awareness about the eyes and things we need to know about the eyes. A lot of people really do not know much about the eyes.
So tell us those things that we need to know about the eyes. Tell us about the eyes. Just tell us the eyes generally before we start asking questions.
Okay. The eye, as we all know, is a very important organ of the human body. It is responsible for our vision. So most of the time, the eyes is constantly at work. Well, from the moment we wake up till we go to bed at night. The eye basically is something that people do not, even the government, we do not really pay so much attention about the eyes, and we use it a lot. The eye basically, today we'll be talking about refractive errors, why people wear glasses. We get a lot of people come in and say, oh, I don't, like you said earlier, we don't want to wear glasses. I'm not in the mood for glasses. So there are different conditions that could make someone wear glasses. And we'll start with the common ones, which is the nearsightedness known as myopia, farsightedness known as hyperopia and astigmatism. Then there's also presbyopia. Okay. Myopia is a condition that is responsible for poor vision at far. You can actually see things clearly at near, but you can't see someone far off. And what is responsible for that? Myopia has to do with the shape of the eyeball being a bit longer than normal. So normally in science, we're all taught that if you look at an object, the light passes through the cornea, the lens, to the retina. Now, for an object to appear clearly, it needs to appear, the image needs to fall on the retina. But for myopic patients, it falls before the retina. For benefit of that, I would like to use this table just as an example.
Okay.
If people can see it. No, it cannot be seen.
No, you
Okay.
can say it if you want to.
Okay, so I will take it to be the retina.
Okay.
I am the eye.
Okay.
So I am the surface of the eye. Light passes through me. For image to appear clearly, it needs to fall on you.
Okay.
But for myopic patients, it falls before the
Before
retina.
the retina.
Before the retina. So that's why you experience the blur at far. So you need lenses to help take those images to the retina so that image appears clearly. And most of the times, the symptoms patients come in with for myopia is blur at far. They tell you, oh, I squint when I want to see far. They tend to close their eyes more to see images clearly. They complain of headache, blur vision, eye strain, because they constantly strain the eyes to take the muscles constantly put extra effort to take the image to the retina. Then for hyperopia that we all know is known as what we normally call long-sightedness. It has to do with the shape of the eyeball being shorter than it ought to be. So for hyperopia, image falls after the retina. Like I was saying, if I'm the eye, you are the retina, image goes behind you,
me.
and that's where it drops. So you need those corrective lenses to help you take it to the retina. That's for hyperopia, and most of the time they complain about distraction or eye strain when they do close work, near work.
Yeah.
You see people complain of inability to read for a long time, especially our children. When they have those complaints, as much as possible, take them to see an eye doctor. So hyperopia, image falls after the retina. You need lenses to take them back to the retina. Then there's astigmatism. Astigmatism basically has to do with the shape of the eye. The eye is usually round, like a ball. But for some people, it tends to be oval, like the shape of an egg. So image now forms on 2 or more spots.
Okay.
So the light gets scattered on, before, after the retina. It could be a combination of both. So the image are scattered. So you need those lenses to help merge those images together to form as one on the retina. That's for astigmatism. Most astigmatic patients most times complain of double vision. You see people complain, especially kids complain about skipping of letters, skipping of words while they read, eye strain, because the muscle is constantly working for you to see better.
Okay, now let's look at the children now. Because sometimes you see little kids wearing glasses. Are those glasses corrective, or they're going to wear them for a very long time, or like forever?
Yeah. Most of the time, you need to wear them forever. I hear patients come in and say, oh, I was told that she just needs to, or he just needs to wear it for 6 months and it's done. That's not possible. Or some will just stop on their own. Those are corrective lenses. When you wear them, your vision is better. You see better. The muscles are relaxed. The moment you take them out, you are straining again. Most at times, when you have kids as patients, you always do a follow-up. If you see the need for them, the doctor is the one to tell you if you are to stop or not. But most of the time, it's always rare before you see a patient being advised to stop. But if the child starts early, it could drop, it won't go worse. But when you decide to just ignore, wear for a while and stop, the refractive error keeps increasing, and that's a major challenge.
I'm sure a lot of parents don't understand that word corrective lenses, because some will say they are supposed to be corrective lenses. I'm sure the eyes are corrected now, you know, and then they stop, because I actually know a parent who says, oh, these glasses are corrective lenses. After a while, the child will stop wearing them. I mean, that while we don't know. And then she will say that, well, just for a few more times, and then she'll stop wearing. My child is too young to wear glasses, you know. It bothers me.
Yeah. Yeah, we see parents coming that would not even bother to get it. You see a high myope or an hyperopic patient, and you tell the parents the child needs glasses, and they tell you no. My child, she's too young, he's too young. Some will get and stop on their own. But the best bet is when you get those lenses, your doctor is the right person to tell you stop, or we need to reduce the prescription, or we need to increase the prescription. So your doctor has the final say on if your child is to stop or not. You do not stop on your own.
Okay, is it possible for one to just go to a shop and say, okay, I see them a lot, especially those who hawk glasses on the streets, in hold-ups and all that. They say, oh, this one is for reading. This one is for seeing at night. This one, I actually see people patronize them.
Yeah.
You know, this glasses is for reading. This one is for seeing at night. This one is when you want to drive. You really need these glasses, you know. They hawk these glasses and people buy. Is it right to go buy glasses, or you go for prescription? You go to see a doctor who will prescribe for you, and then you run some tests instead of just going to the road to buy. You know, Nigerians, we're always, it's quite expensive to go to the hospital. You see an ophthalmologist, you see an optician, you see all of them, and then, you know, like the process is so long and all that. They just wait by the roadside and buy. You know, they will actually provide you newspapers and all that, different kind of books.
Yeah.
Okay, take and read them, see, you know, and people just do it.
Okay, yeah, that's common for the fourth type of refractive error I was going to talk about, which is called presbyopia. Presbyopia has to do with the crystalline, the lens of the eye. It's elastic in nature, but as you go older, it's like your skin. The way your skin was when you were 20 years is not the way your skin is looking now. Of course. So it's same for the eyes. The crystalline lens is elastic in nature. It's very flexible, but as you grow older, it becomes weaker. The ability to focus on near work becomes a challenge. So you need those lenses, and normally it starts from the age of 40. Now, it's very common. You see them, I buy from Ring Road. I buy my readers from Ring Road. It is very wrong, because for your near work to be corrected, you need to correct your distance prescription first. If you have challenge with seeing far, that needs to be corrected to get the right prescription for your near work. So you see a lot of patients who say, I buy from, and those people, they just give you any power. They'll be increasing it. The more, some will say, make it bigger. This lens is not supposed to be a magnifying lens. It's just a lens to make you see the letters clearly and your eyes are relaxed. It's not supposed to increase the size in any form. But most of the time you see them, they get those lenses and it starts increasing the size of the lenses, and so it's working very well. But after a while, they keep running back with headache and all sorts of complaints. So your best bet is see an eye doctor, go to a clinic and get your eyes examined. There is more to the eyes than just, oh, you give glasses. If you come in with all these complaints of headache, strain, itching, I will still need to do all that tests to be sure to rule out any form of pathology before we now start saying, oh yes, this is a clear case of refractive error. So your best bet is see an eye doctor before you get any lens.
So what are other problems that can happen to the eyes? What are other, you know, sicknesses that can happen to the eyes?
Of course, the one that is making waves now, glaucoma. Glaucoma, there's cataracts. So I'll start with glaucoma.
Please do.
Glaucoma is a group of eye disease that affects the optic nerve. The optic nerve is the nerve that connects the eye to the brain. When you look at an object, the eye sees the object, transmits it to the brain through the optic nerve. The brain gives you an interpretation of what the eye sees. So the brain is actually what is interpreting what we see. Now, when those optic nerve keeps dying, it leads to loss of vision. Okay. And science has shown that the major cause of this is due to increased intraocular pressure. Now, the advantage you have when you go and see an eye doctor than you just go to the roadside and get those glasses is when you come in, they screen for all those, because there's no warning sign for glaucoma. All over the world, glaucoma is known as the silent thief of sight. It does not give any warning sign, no symptom. In fact, a patient with glaucoma will tell you, I can see from here to Ring Road, but the vision is being lost, because for glaucoma, you lose your vision from the side. So it is at the late stage you now start hearing complaint of, oh, when I'm driving, I look at the side mirror, some parts appears black. So for glaucoma patient, there's no warning sign. You need to see your doctor to diagnose it. They say early detection is key for glaucoma, because the risky thing about glaucoma is vision loss can never be gained. So if you go in early enough, you manage to save your vision early. But if you go in late, there's little or nothing the eye doctor can do for you other than to manage what is being left. So the risk factors for glaucoma basically are increased intraocular pressure.
Intraocular pressure.
And science
when you say intraocular pressure, what are you talking about?
Okay, thank you. The body, we all know blood pressure. The eye has what is called the intraocular pressure. So there are special machine that we use to test for the intraocular pressure. The normal range is between 11 and 21 millimeter mercury. It could be higher. Then you see some patients is within the normal range, but there are other signs to show that, oh, this patient is a glaucoma suspect. So that's why there's this gospel of glaucoma, create awareness on glaucoma. All over the world, there's a week called Glaucoma Week to celebrate glaucoma, just to create more awareness about glaucoma, because it is very risky. Once vision is gone, it cannot be restored for now.
The fact that there are no signs, no symptoms, it just happened, is what really frightens. You know, we live in the part of the world where people don't go to the hospital until the dying minute, until that person just cannot do any other thing but to go to the hospital. But this one, that there is no sign, nothing, no pains, absolutely nothing. One may just wake up one day and then the sights are gone. It's very frightening. So what's your advice?
My advice remains, go for a comprehensive eye examination every 2 years. But there are some people that are on the watch list. Your doctor might tell you, come in every year, come in every 6 months. I always advise people, go with your doctor's plan, because when you go in and you are diagnosed of glaucoma, you are placed on eye drops. Sometimes they do surgery. Some patients, I've seen a lot of patients, they use those eye drops for 3 months, 6 months. They'll say, I use them, I don't see anything, and they stop. Glaucoma, the truth is, when you are placed on those medication, you are going to be on them for your life. So just as much as possible, comply, use those eye drops, go for your appointment if you are placed on any, as much as possible, so the doctor can manage your vision. I've seen some people, by the time they come back, vision is already gone. So that's already too late. Meanwhile, they were diagnosed early enough, but because of mismanagement, sometimes some patients will tell you, oh, the eye drop is expensive. But that is what it is. For now, we just need to try as much as possible. For those of us that have family history as well, that's a very important part of the risk factor. Yes. If there's anyone that has been diagnosed in your family, your father, your mother, your grandparents, auntie, of glaucoma, that family is at risk of glaucoma. So as much as possible, you need to go for routine check. Most of the time, if a patient comes in and is diagnosed of glaucoma, we advise you to bring in your children. Tell your siblings to go in for glaucoma screening, because you are at a risk of being a glaucoma patient once it is in your family line. So
how do you do the screening? You just look at somebody's eyes and say, okay, this eye is a glaucoma suspect?
Not at all. Not at all. If I look at you now, I won't be able, I don't even know if I have glaucoma if I don't go for the screening. So once in a while, I do the screening myself as well. So the thing is, when you come in, your visual acuity is checked. We do the ophthalmoscopy to get a good view of the back of the eye, which is the optic nerve, to see if it's okay, or if there's any sign of glaucoma tracing on it. Then we do your intraocular pressure test. Then we also do your visual field analysis to see how good your visual field is, to see if any part of the optic nerve is already being affected. So with that, if there's need, if there's still room for, is it not, you can then refer for OCT.
Okay.
Yeah.
Okay, is there an age thing? Does age have to do with glaucoma?
Yeah, science has said that from age 40, we are at risk of glaucoma. But you see young children who have glaucoma. You see 6-year-old, 7, 8, 10-year-old that are glaucoma suspects, that are known glaucoma patients. So there is really no age limit, but those that are more at risk, they say from age 40.
Does food have to do with it, like what we eat?
Yes, okay. There's this school of thought of monosodium glutamate, our spice. As much as possible, I preach it to my patients a lot, as much as possible, reduce your intake of spice, Do not say, oh, it's
That's
sweet.
Processed spices.
Yes, those processed spices that we use to sweeten our food, they contain monosodium glutamate, which has been proven to be a cause of glaucoma.
Okay, so as much as we can, we just reduce it.
Reduce it as much as possible.
All right, well, so looking at the care of the eyes, and I'm talking with Dr. Irade Ozo, and she's been talking so much about this. If you want to call us, please do that on 052290573. We're going to put the numbers on your screen. So call, ask all the questions you need to ask about the eyes. So we talked about glaucoma. Let's look at cataract. Okay, glaucoma, you say, is irreversible. Once it happens, it has happened. Nothing can be done. That's quite sad. Not even surgery.
Surgery is to manage what is left.
All right, let's look at the other one, cataract.
Okay, cataract. Cataract has to do with an opacity on the lens. The lens is at the front of the eye. The lens is where light passes through to your optic nerve that translates image to your brain and all of that. But for cataract patients, there's an opacity on the lens. So there's the tendency for light to pass through is difficult. So you experience blur image. But the good thing about cataract is it can be reversed.
Okay.
So when there is an opacity, you go to your eye doctor. Most times people mistake it for refractive error, say I cannot see. Most times that opacity does not mean, fine, it tends to look like, oh, I can no longer see with my eyes. It could be on one eye, it could be unilateral. So it depends on the patient. So when you go into your doctor, he or she checks, and when it is matured, you can be referred for surgery. So surgery is the final solution for cataract.
So how is cataract like? How do you know this is cataract? How is it self-diagnosed? Can one just see and say, oh, this is happening? The
symptom that you would have is, oh, blur vision.
Okay.
My vision is smoky. So you come in. So with a special tool, I check. I cannot just look at you and say, outrightly, this is cataract. So when I check, I will be able to say, oh, this is cataract. Either we wait for it to get matured. When it's matured, we refer for surgery, or if it's not matured, we just place your medication pending when it gets matured. That's basically it. Pending when it gets matured, glasses do correct, gives you a better vision. Okay. But when it's matured, there's really nothing the lens can do anymore for you, the pair of glasses. So you need to go in for surgery to take out the opacity, blocking the light rays from going in.
And after which the person will be fine.
Vision is restored.
And the person will still be on glasses.
Yes, most likely.
Okay, let's look at this minor one called, popularly known as Apollo, conjunctivitis. You know, when it happens, I've seen a lot of persons do quite a number of funny things to their eyes. Oh, this is conjunctivitis, and it's when the person has it, the next thing is they're looking for a breastfeeding mother to, you know, extract some breast milk into the eyes. Some are cutting onion, you know, placing it around the eye like something like a ring. You know, they do all sorts of things, and some person will say, oh, go spitting a little bit of fuel into the eyes, and you begin to wonder, are this part of care of the eyes, do they help or do they damage the eyes?
Of course, they damage. Most of the time, they don't call it conjunctivitis. They say Apollo.
It's Apollo.
It's Apollo, they call it. So when there's this bacterial infection, your best bet is to come into the clinic. Most of the time, there are different types of conjunctivitis that people don't know about. So most of the time when they have it, you'll say, I go chemist, I got a Vicin. Or some will just say, get any bacterial eye drop.
Okay.
No. There's more to it.
Okay.
So when you get that sign, redness, discharge, I advise you, please go and see an eye doctor. Okay. They would check and diagnose what type of conjunctivitis it is and place you on the right medication for it. So
there's no need to put in all sort of things.
Oh, for that, there's no need for all of that. Those onion, milk, breast milk, they'll say early morning urine. I saw someone like recently that said that early morning urine.
Yes.
It doesn't make sense. As much as possible, avoid those things.
But it does work for some persons. I'm sure that's why they prescribe.
1 in 50 million people. We've seen people that have done that, and when they come in, the vision is already affected. If they want to open up, then some will not even tell you. They will just tell you, I did not use anything. But investigate more, you find out that they did all those. It's like putting bacteria on bacteria.
Adding salt on injury.
That's it.
All right, the program is Healthy Living on ITV. We'll quickly take a break to do something. We want to take you to the street and see what's happening on the street. How well do people know about their eyes? We'll be back.
Eye checkup.
Yes.
Okay. Like how long ago?
That was 2014 again, because I've been using lens. I think I used lens for up to 15 years before I stopped.
Okay. Mr. Efosa.
Thank you.
So, Mr. Efosa, have you ever had your eyes checked, like a comprehensive eye checkup?
No.
Okay. So, have you ever had the red eye?
Yeah.
When you had that red eye, what did you do?
I went for checkup.
Okay. After the checkup, when they gave you the drugs, they gave you drugs definitely.
Yeah.
Did you use it?
Yeah, they gave me drugs and some eye drop, an eye drop.
Okay. Okay. So have you ever had a red eye?
Red eye, yes.
What did you do when you had the red eye?
I didn't really go to an optician. I went to a pharmacy and they gave me an eye drop, and that was what I used.
Have you ever had a red eye?
Yes, of course I do, because I normally scratch my eye then. So, and something will now red, like, so, but since I start using this Passalad, so something was like...
Okay, did you get that job from a clinic, eye clinic, or where?
No, so it's one store like that.
Okay. How do you care for your eye?
My eyes? Naturally, I just eat good food, especially ample. Then I sleep well when it's necessary, and I try not to reach under this Florence, this yellow lamp. So.
Okay, ma. Okay. Okay. If you're giving 50 million to give up one of your eye, will you do that?
For what? No, I will not. So.
Okay, what if they increase the money to 50 million?
I will not. Because
okay.
eyes are very, very special, you understand? So definitely it's not necessary for me to lose one for 50 million. So I can still walk up to that, you understand? So if I lose the two eye now, what will I use to see? Or how will I make the 50 million and all that? So I cannot give up my eye for 50 million or one of my eye for 50 million.
Guys, how well do you know your eyes? There, some funny replies there. Some persons have never ever gone to the hospital to go check their eyes. Some will not go, no matter what you say to them. Some persons will tell you, oh, my grandfather is like 80 years, is not using glasses. My mom never used glasses. Why should I use? I used to be of that school of thought too. It took quite a long time before I went for glasses. You see, I had this boss who will come into the studio when I'm reading news, and then the next time I catch you like this, I'll do this. You know, the stress was becoming too much. I said, okay, let me go to the hospital and do myself some good. And honestly, since then, the headache kind of disappeared, you know, and, you know, I read with ease these days, unlike before. You know, it's like when you use glasses, people look at you as old or inadequate. Oh, that is the word. Oh, this person is inadequate. It's just like asking a woman to go for CS. And she's like, no, I want to give birth naturally. That makes me a complete woman. CS will make me like inadequate woman and all that kind of a thing. So doctor, just hammer on it a little bit so that that person who ought to go use glasses will find him or herself to the hospital.
What I tell my patients is glasses, using of glasses does not make you less of a human being. In fact, it makes you function better. It makes you more efficient because now you obviously will see better and you are more relaxed. At the end of the day, that headache, that eye strain, that squint, it's all gone and you see better. I don't know, some people have really that school of thought of my family, my father is 78 years, he has never worn glasses. And you are not your father. You are not your father. And you are a different being. So as much as possible, when you don't fight it, when you notice that your vision is blurred, when you notice you have headache after you use your eyes for a while, when you notice any form of headache, any form of eye strain, as much as possible, go see an eye doctor, get yourself examined, and if there's need, when you go in, if you need glasses, you would know. From the test, you will see that, oh, really, I can't see this. I've seen patients brag outside that, oh, I can see everything. And when they get into the examination seat, they will not be wondering, oh, is it really that bad? And one thing is, both eyes don't see equally. So sometimes you
naturally.
see, yes, you see some patients that one eye is really bad, but the other eye is doing very well. So that good eye now makes them think they can't see without knowing that one eye is gone. In fact, I had a cousin of mine
So
coming
you
and
don't really need two eyes to function.
so of course, some people function with just one eye. They asked the question, will you give out one eye for 15 million? so you see some people, they don't even know. Some know they are not bothered. At least one is working now. I can do without the other. If you keep stressing that one eye, it goes to a relaxed state, a lazy state, which is called amblyopia. So as much as possible, your glasses would help that eye to pick up and you see better. You function better. I don't believe in that school of thought that says if you use glasses, you are inadequate. I started using glasses for one in GSS2, and I did not feel that way.
Okay, lucky you. You know, some will believe that the more you use glasses, now every year you kind of add to the thickness of the glasses. That's what people think.
No, that's different. That's for presbyopia. It's assumed that every 2 years you might need to increase the power because, like I said earlier on, the crystalline lens becomes weaker and weaker. Of course, as you are going older, so you need to increase the power. That does not make you a patient that has one pathology or the other. It's just nature at work. So with your glasses, you are good to go.
Okay, now while we went on that short break to bring that clip, somebody asked a question back there. What is what are the causes of teary eye? Why do people have teary eyes? Like okay, we'll take this call now. Hello, caller. Good afternoon. Good afternoon. Please tell us your name and ask your question.
Hello.
Hello.
Hello. Good afternoon.
Good afternoon.
Good afternoon.
Yeah, my name is Ufoma. I'm calling on behalf of my son.
Okay.
He has strabismus. I usually back him like that though.
Your son has
And
what?
He comes and goes. Strabismus. It's normal. After a while, the eyes will not be changing to strabismus. So I don't know whether you can say anything about it. It comes up and on. It becomes normal and it changes to strabismus.
Okay, just hold on a while.
strabismus.
Lazy eyes. And lazy eyes.
Okay.
I don't know whether it's the problem.
Okay.
Okay, have you seen an eye doctor for that?
Hello, can you hear me?
Have you seen an eye doctor for that?
I said it comes off and on.
Have you
It
taken your
becomes
child to
normal
see a
after while
doctor?
To change later to lazy eyes.
Okay,
I don't know
Ufoma,
whether there's
hold on.
anything that you can say about it.
Okay, have you taken your child to see an eye doctor?
Have I taken
Your child to see a doctor?
for?
To see a doctor regarding the...
I'm not. That's why I'm calling.
Okay, so
Ufoma,
Ufoma, if you notice that the eyes deviate outward or inward,
when it was around 6 months, that's when it started showing.
okay, so I would advise you to take your child to see an eye doctor. The earlier, the better for you. Since the child is quite young, there are ways to manage such conditions.
Okay.
Yeah.
All right, before that call came in, we're talking about teary eye. What are the causes of teary eye? The person has a 5-year-old who is constantly in tears.
Oh, sorry.
Yeah, we're talking about somebody who has a 5-year-old
Okay.
child who is constantly in tears. Like the eyes, she has this teary eyes. Let's take this call. Hello, good afternoon. Good afternoon.
Yeah, please, I have some questions to ask.
Go ahead, what's
I'd
your
like
name,
you to
please?
note them down.
Can you tell us your name first?
I have some questions to ask.
I know, tell us your name.
Okay, my name is Chooks.
All right, Chooks, go ahead with your questions.
Yeah. And please, first of all, the cataracts, after cataract operation, can it reoccur? Can it grow back again after surgery? That is one. Two, like I have an eye issue, which also I have handled, reasonably. But there's some of these drugs that we are using, like glaucoma issue, very expensive. Yet we are using them. But the issue of antioxidant, is it compulsory? If you don't use it, will it cause any harm? And if you are using your drugs,
No, we don't call drugs, just say use of drugs.
Hello?
Hello, go ahead.
Yeah. So you also said it's a cataract is reversible. You know what you said?
Is that what?
Cataract is reversible, yeah.
Reversible.
Is that all?
Yes.
Okay. The first question. After cataract operation, can it reoccur?
No. Cataract, when you do your surgery, it's not supposed to reoccur. But if you notice that your vision is blurred, go back to the doctor that did that surgery to find out if there was complication after the surgery.
Okay.
Most of the time, when you place patients on medication before they do the cataract, it's just to help the back of the eyes so that when the operation is done, when the opacity is taken out, the vision is restored. So you get good results after surgery. Then he said something about glaucoma.
Talking about the drugs, that the
That
drugs
is
are quite
right.
expensive.
Like I
Is
said
it
earlier,
compulsory that you continue with the drugs?
Yes, sir. You need to, like I said, you need to continue with those drugs because when you don't, then it starts getting worse. The thing with glaucoma is this. Those eye drops that you are giving is actually to manage the intraocular pressure, to put them under control so they don't go out.
They don't go haywire.
Yes, they don't go wild. So as much as possible, when you are placed on those eye drops, sometimes there are some eye drops you place, give some patient just to control it, let it just remain where it is.
Okay.
So sir, the truth is you need to be on those medication as often as all the time because like I said earlier when I was talking to you, there are some patients that stopped because of cost or I wasn't seeing any difference. Then by the time they come in 2-3 years after, it's already late.
So those drugs are supposed to be taken like forever?
Yes, ma'am.
Wow. Okay. And he did ask if it's true that cataract is reversible. That was the thing he said.
Yes.
But glaucoma is not.
Glaucoma is not. So that's the difference between glaucoma and cataract. Glaucoma not reversible, cataract reversible.
All right. Hello, caller. Good afternoon.
Good afternoon.
Please tell us your name. What is your name, please?
Hello, doctor.
What is your name?
Kiru.
Nkiru.
Yeah.
All right, Nkiru, ask your question.
Please, this glaucoma, is it curable?
Okay, Nkiru wants to know if glaucoma is curable. That means Nkiru didn't follow us from the beginning. All right, doctor, re-echo the fact that glaucoma is not curable.
You have answered it. Glaucoma is not curable. It is only manageable. You manage what the patient comes in with, the vision the patient comes in with, as much as possible, you manage it. Because it is not curable, that is why they say early detection is key. As much as possible, save what you have, go for your routine eye check. Even if there's no loss of vision, go in if you're a glaucoma suspect and placed on medication, as much as possible, just be on that path.
This idea of going to see the doctor and paying the doctor when you're not sick is very heavy on most of us, you know. There's nothing wrong. You just walk into the hospital and say, oh, doctor, give me a total check. And then you pay.
In the Western
you know,
world,
it's very heavy on some of us black face people.
Yes, in the Western world, every child within the age of 3 going for eye examination before you start school. So my sister, for one, her child did not have any complaint. But when she went in, she had high cylinder, she had eye astigmatism. Okay. But there was no sign, no complaint. Until today, she's wearing her glasses and she's doing well. That's when she was not saying, oh, I noticed that when she's writing, she skips words. Okay. Oh, I did not know that was the cause.
So every child should go for a test?
Every child should.
All right. Hello, caller. Good afternoon. Hello? Hello? Reduce the audio level on your television set, please, or you move away completely from where your TV is so that we can, you know, relate very well. Hello, caller. Good afternoon. Hello? Hello? All right, while we're waiting for more calls, I did ask a question about teary eye. What are the causes of teary eye, or what is the cause of teary eye? Why must a child keep having tears in her eyes continuously? It's not as if she's crying or she's been beaten, but the tears just keep coming. Hello, caller. Good afternoon.
Yeah, good evening, ma'am. My name is Peter.
All right, Peter.
Good evening.
Yeah, I'm a glaucoma patient.
Okay.
So I did my test last month.
Last year?
Last month.
Yes, last year.
Okay, last month. Okay.
Yeah. So for some time, I've been wearing my glass. So it got to a point, I'm still wearing my glass, but sometimes I feel headache on my head.
Okay.
So I just want to really know what to do. That's why I called.
Okay. A glaucoma patient,
Okay.
sometimes he feels headache.
When he wears his
and
glasses.
goes.
The thing is, Mr. Peter, your glasses does not have anything to do with the glaucoma you are managing. So if you have issues with your glasses, go see your doctor. Most likely there might be a change in your prescription that needs to be corrected. You undergo an eye examination, and if they need to change your prescription, they do that for you. So the glaucoma and the glasses are not intertwined.
Okay.
Yeah.
All right. I hope you got that, Peter. Hello, caller. 052290573 is the number to call. Call the doctor. Ask all the questions you need to ask, because your eyes are so important to you. Hello.
Hello, doctor.
Good afternoon.
Good afternoon.
Good afternoon. My name is Chooks. I called earlier.
Okay, Chooks.
Yes, there was a question I omitted. Assuming I was diagnosed of cataract, maybe little, or they said it has not matured. Must it mature? Can it stay without getting matured until I'm old?
Did you get that?
No, I didn't.
Okay, I think he says he has signs of cataract.
Oh,
and
let me
wants to
repeat what
know.
I said.
Okay, ask the question again, please.
I said, assuming I was diagnosed of
Cataract.
having cataract, but
Yeah.
very minor, not matured.
Yeah.
No.
Maybe in the process of examining my eyes, they discovered that developing cataract. Then they said that it's not matured. It's my nigga is little. I'm asking if that cataract must get to maturity, or is it possible that it stays as it is until I get old?
Okay.
Yeah, there's no time limit for cataract to get matured. For some people, it could take 3 months. So for traumatic patients, a day is already matured. You need to take out. So there are some people that have lived with cataract for 10, 20 years. It did not get matured. As far as your vision is still, you can still see, is not matured, you are good to go. Whenever it gets matured, the doctor is in the best position to tell you, come in for surgery.
Okay. All right, 052290573 is the number to call. Hello? Hello? All right, some persons just want to call to hear their voice, but we're doing something very serious here, okay? We're talking about your eyes. Very important. Hello, caller. Reduce the audio level on your television set, please. Hello, good afternoon.
Good afternoon.
Please tell us your name and ask your question.
I'm Festus.
All right, Festus.
I'm Festus from MMO.
Okay, you're welcome.
I don't know.
You don't know what? All right, call us again, 052290573. While we're waiting for other calls, doctor, we're talking about teary eye.
Yes.
Why do somebody just keep bringing out tears? She's only 5.
Okay, it could happen to older people, it could happen to children. Most times, teary eyes is associated to either refractive error or dry eyes. So when you experience teary eye, don't just sit at home and do nothing about it. I would advise go see an eye doctor. They would check. If it's a refractive error, they give you the corrective lenses and that teary eye stops. Or if it's dry eye, you will be placed on medication to help out with the dry eyes.
Okay.
Yeah, so
and that will
that will
stop.
resolve it, yeah.
All right. Hello, caller. Good afternoon. 052290573 is the number. Hello. 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 All right, Doc. While we're waiting for calls, are there food or fruits that can improve the well-being of the eyes? Okay. Hello, caller. Good afternoon.
Good afternoon.
Please tell us your name and ask your question.
I'm Uche from Benin.
All right, Uche. You're welcome.
Please, there is this thing that always happens to me. And whenever I want to look something, I want to read newspaper. When I bring it close to me, I will see it clear. Either I shift my hand a little bit before I see the word clear. What is it called?
Okay, If I hear Mr. Oche correctly, when he brings his phone close, he can't see. But when you take it at arm's length, you can see.
Yeah.
That's a clear case of presbyopia. Like I was telling you earlier, it comes with age, Mr. Oche. So God is blessing you with long life. So for presbyopic patients, when you bring things close, it's blur, but when you take it far, it's clearer.
It's clear.
Go see a doctor, an eye doctor, and get your eyes examined. You might just need a pair of corrective lenses to help you see things clearly without having to strain. If you continue with that strain, it gets to a point you start having headache, eye strain. So as much as possible, see an eye doctor and get your eyes examined.
Okay, should I need an eyeglass?
Yes, that's most likely what you would need.
Okay, that's what I want to know. I want to know because it's long ground, that managed to read. When I see it, not a little bit or not far like that, I'll be seeing it.
Yes, sir.
I want to read anything.
How old are you, Mr. Oche? How old are you, sir?
I'm now for something.
Good. So it starts from age 40. So it's a normal thing. It's nature that is at work. Go see an eye doctor, get your eyes examined, and you'll get a pair of glasses to help you see comfortably.
Okay, thank you.
You're welcome,
All
sir.
right, you're welcome. All right, 0522905573 is the number to call. All right, doctor, we're talking about fruits that can improve the well-being of the eyes.
Yeah. Okay, so there are lots of food that we can actually take in to help the eyes. What you eat is what you see.
Yeah.
So most of the time, I always advise people eat right.
Okay, doctor, just pause there. Hello, caller. Good afternoon.
Good afternoon.
What's your name, please?
I am Moto Agua.
Okay, so ask your question.
Okay, doctor. If somebody is diagnosed with cataract and is not matured, can it not be operated upon? Or if it's operated upon without being matured, will it reoccur again?
Okay, you got that question? If somebody is diagnosed of cataract and is not mature, can the person operate on it? And if the person operates on it when it's not mature, are there going to be complications?
Okay, your best bet is when it's matured, the cataract is taken out and you see better. If you take it out when it's not matured, there's every tendency that it could reoccur.
Okay.
So it's always advisable you wait for it to get matured. When it's due, you take it out.
So who determines the maturity?
The doctor.
The doctor does, and they give the person time.
It's not matured and the person is not saying that it's losing its sight.
No, if you are not seen, then most likely it is matured. That's why you go to the doctor checks. If you are not seen, if the vision is now very blurred, I would want to suspect that it's almost matured, if not matured. So go into your doctor, let them check, and if it's matured, they'll advise you to take it out, sir.
Thank you.
Yes, sir.
Okay, there are some persons that find it so difficult to drive at night. Before we go to the food and fruits, you know, you're seeing lights. I often hear people say, I don't like to drive at night because, you know, the lights are scattered, lights from other cars. It's difficult to see in the night. Is that a big problem?
Yeah, there are some people that are sensitive to light rays. Glare affects the eyes. So there are special lenses that you could actually recommend for such patients that will make them see better to knock off those light rays from affecting the eyes. You have the anti-blue light, you have the anti-reflective.
All right,
So
Dr. Radio, we have just 2 minutes to go. Let's quickly run over the food and fruits that...
Okay, yeah. For the food, as much as possible, take in lots of carrots, cucumber, green vegetables, fish. Those things really help the eyes a lot.
Okay.
Yeah.
All right, doctor, thank you very much for being part of the show. I know that there are so many persons that still want to call. All right, do a follow-up by calling this number, 070-3636-1216, 070-3636-1216, okay? Call this number and you'll be able to talk very freely with the doctor. I know some persons don't like us to hear their voices on air. It's all right. Thank you very much, doctor, for coming on the show.
You're welcome.
All right, people, this is all we're doing today. Happy World Sight Day. Go and do a check on your eyes.
Yeah.
A penny, they say, well spent is always very sweet. We'll see you again. Bye-bye.
Bye.